So good day to our clinical instructor, Mrs. Marisu F. Gual. I am Mary J. S. Folio. And for today's return demonstration is I'm going to demonstrate about the administering of the rectal suppositories. So before doing the procedure, let me first state its purposes. So first is to provide temporary relief to clients who can't tolerate the oral preparation. Second is to induce defecation. Third is to relieve pain and local irritation. And fourth is to reduce fever or treat fever. And the last one is to stimulate peristalsis and defecations in clients who are constipated. So now we are going to do the procedure. So now we are ready to do the procedure. So first step is to review the doctor's order, including the client's name, the medication name, the form, the route, and the time of administration. So this is to ensure that the correct administration of the medication. So we have here the doctor's order. So the doctor's order is Dulcolax, 10 milligrams per suppository, 1 per rectum, stat, which is we will give it right away. Okay, so that's it. Then the next one is to review the medical record for the rectal surgery or bleeding. So these conditions are contraindicated with the use of rectal suppository. So very well, the patient has no record for the rectal surgery or bleeding. Okay, so now we can proceed. So next step is we're going to wash our hands to reduce the transfer of microorganisms. Then the next step is we're going to apply a disposable sheet. Okay, so before doing that is I'm going to identify first the patient by checking the identification bracelet and ask the client to state his or her name. So it is very important to identify first before approaching the patient. Okay, so good morning, ma'am.
Good morning, nurse.
So ako din mong nurse karon, ma'am. Ako si Mary J. S. Folio. So kamusta karon, ma'am, adlaw?
Kailan nurse pero mag-release ng biscuit akong tingin kasi constipated ko.
Okay, very well, ma'am. So, alayon ko kuan, ma'am. State sa imong name, ma'am. Sa ito itong pangalan.
Marie Griffon, nurse.
And the date of birth, ma'am.
November 11, 2001.
Okay, so akong i-check. Ma'am. So, name of the patient, I.B. Marie C. Griffon, and the date of birth is November 11, 2001. Check ko.
Yes, ma'am.
Okay, ma'am. Thank you for that. Okay, so now is I'm going to apply the disposable sheet. Okay, so akong i-apply ang disposable sheet, ma'am, so that later on sa atong procedure, ma'am, ma-minimize na to ang pag-contact sa mga infected fecal material. So, alayin lang po ko. Okay, comfortable na ka, ma'am? Very well. So the next step is we're going to explain the procedure, and let's be specific if the client wants to self-administer the medication. So this is to promote understanding and cooperation of the client, as well as this allows the client to self-administer the medications for the physically able patient. Okay. So karon, ma'am, ako i-explain yung mga procedure. So okay na ba, ma'am?
Yes, ma'am.
Okay, so karon, ma'am, is nata diri ang medication mo, ma'am, which is the Dulcolax. So laxative siya, ma'am, or stool softener. So unsa man na, ma'am. So meaning, ma'am, constipated man ka, ma'am. So iyang ipahumok imong tae, ma'am, para sayo na nimo pagpagawas. Okay? So dili na kayo painful, ma'am, during pumalibang ka, ma'am. Okay? So unsa imong ganahan, ma'am? Ikaw mo administer pero mo guide lang ko, or ako mismo ang insert sa medication sa imong rectal, sa imong lubot, ma'am.
Ikaw lang, nurse.
Okay, so ako lang administer. Thank you for that, ma'am. So now we're done explaining the procedure to our client. Next is we're going to arrange the supplies to ensure the proper to ensure the smooth flow of our procedure. So we have here our medications placed in a transparent container. So we also have here the medication card, the tissue to wipe the patient and the client later on. We also have here our lubricant and the container. We have the alcohol, we have the 2 gloves, disposable gloves. We also have here our glove for draping the client. We also have here our waste receptacle and the bedpan to offer our client later on. Okay, so that's it. Then we're going to close the room curtain and the door. So assuming that I already done closing the curtain and also the door. Okay, so this is to maintain privacy and minimize the embarrassment rather. Okay, so now is we're going to assess the client in assuming Sim's position, and we're going to keep the client draped. So only the renal area will be exposed. So this is to exposes the anus and also helps the client to relax the external anal sphincter, and this is also to maintains privacy and facilitate relaxation. So ma'am, ako nang i-position ikaw sa since i-position na ikaw ma'am, so alay yung paghatag sa inyo. So I'm very sorry for that ma'am, since the bed is not enough to let the client roll over to have a proper since position. Okay, so I will let this client. Okay, so I will adjust this disposable sheet. So comfortable na ka ma'am? Okay, so are you comfortable ma'am?
Yes.
So the next thing to do is we're going to examine the condition of the anus. But before that is I'm going to wear my gloves. Now I'm going to examine the condition of our anus externally. Okay, and I'm going to palpate the rectal walls as needed. Okay. But before that, I'm going to drain. So assuming that I already exposed the renal area of the patient. Okay, so now I'm ready to examine the anus externally. Okay, so we're going to examine it thoroughly, so to determine if there is an active presence of bleeding. So very well, there is no bleeding. Then I'm going now to palpate the rectal walls as needed. So to determine whether the rectal is really recessed, which may interfere with our suppository placement on later on. So I'm going to palpate it. So assuming that I inserted my finger. Okay. Then I palpated it with 260 degrees to feel the rectal walls. Okay. Okay. So assuming that we're done, and withdraw my finger. Okay. Then since our glass is soiled, so I'm going to dispose it, turning it inside out. Then dispose it in our receptacle. Then wash again if necessary. The next step is we're going to apply our disposable gloves since the previous gloves were disposed. So after I'm wearing our second gloves, now I'm going to remove the suppository from its wrapper, and I'm going to lubricate the round end. So this is our medication wrapper. Okay, so I'm going to put it in the container first. Then I'm going to fill the container with the lubricant, with the water. This is the water soluble. Assuming that this is the water soluble lubricant. Okay. Then we're going to lubricate the round end. Okay. Then we're going also to lubricate the index fingers with our dominant hand, since I am right-handed. So to lubricate my index finger. Okay. So the rationale behind this, because the lubrication reduces frictions, as the medication or the rectal suppository enters the rectal canal. Okay. Then now I'm going to ask the client to take I'm going to ask the client to take slow deep breath through mouth, okay, to relax the sphincter. Okay. So ma'am, ako nang i-administer ang medication, ma'am. So mo-insert na ako sa medication. So alayan na ko kuan, ma'am, ginhawag lalo, ma'am, pero hinay-hinay ra siya, ma'am. Okay, ma'am?
No?
Oo, gamit ay mong mouth, ma'am. Okay, so para mo relax ra yung sphincter, ma'am, hindi kayo siya painful kapag insert na ko. Okay na, ma'am? Okay. So, I'm now before doing that, I'm going to retract the buttocks with our non-dominant hand. Okay, then I'm going to insert the medication gently against the rectal wall. Okay. For adults, it is 10 centimeter or 4 inches, and for children and infants is 5 centimeter or 2 inches. So the rationale behind this is that the suppository must be placed against the rectal mucosa for the eventual absorption and for the therapeutic action of the medication. Okay, so then is we're going to withdraw our finger, so assuming, okay, withdraw, and we're going to wipe the anal area of our patient with a tissue. So before we proceed to our next step is I'm going to demo the procedure again. So using our alternative material for extensive demonstration. Okay, ma'am. So to really demonstrate it, or to really show you how I understand this procedure, ma'am, let me use this alternative. This is a alternative material to represent the anus, and I also have here the medication. Okay, so I'm going to show you, ma'am, the highlighted part, which is the step number 10 and step number 14. So in step number 14, it states that we have to examine the condition of the anus externally and palpate rectal walls as needed. Okay, so then if the gloves become solid, we have to dispose them by turning them inside out and placing them in the proper receptacle. So now is I'm still into the examining the condition of the anus externally. So assuming that so let's assume that I already lubricated my index finger. So we're going to examine for the external anus, for lumps, for the presence of bleeding, for the hemorrhoids, and the other conditions that may contraindicated the administration of the medication. Okay, so this is the anus. So I'm going to insert my finger. Okay, then I'm going to sweep it 360. Okay, to feel for any lumps. Okay, and to determine if the anus is filled with feces. Okay, then rotate again 360 sweep. Okay, to really ensure that there is no clogging of feces. Okay, then we're going to withdraw our index finger. Okay, and okay, so we already done palpating our rectal walls as needed. So that's it, ma'am. Okay, so for the step number 14, so with my non-dominant hand is I'm going to retract the buttocks. Okay, and I'm going to insert the suppository gently through the anus and pass the internal sphincter against the rectal wall. 10 centimeter or 4 inches for the adults, and 5 centimeter or 3 inches in children and infants, and may need to apply gentle pressure to hold buttocks and together momentarily. Okay, so I'm going to insert the suppository. Okay, so 10 centimeters. So my index finger, index finger is almost inserted into the anus. Okay, 10 centimeter for the adult and 5 centimeter for children. Okay, then I'm going to withdraw finger and wipe the anal area with tissue. So the suppository must be placed against the rectal mucosa for eventual absorption and for the therapeutic action of the medication. Okay, so that's it, ma'am, for my extensive return demonstration with the use of this material. Okay, so now let's proceed. Now is I'm going to discard my disposable gloves, turning inside out. Okay, then dispose in appropriate receptacle. Okay, so I'm going to after disposing it is I'm going to ask the client to remain in the position for 5 minutes. But first I'm going to I'm going to remove the draping first. So if the suppository contains laxative or stool softener, just like our medication for today, so I'm going to assist the client if she feels any sensation notification. Okay, so ma'am, before after na na-administer, unsay mo na-feel, ma'am? Kalibangon ka, ma'am? Okay, so makontrol pa nimo, ma'am. Okay, so kung dili nimo makontrol, ma'am, then pwede ko ma-assist, ma'am, kayo sa toilet or yung offer ko nimo headband. So, ingnan ako, ma'am. Okay, thank you for that, ma'am. Then after that is we're going to wash our hands to reduce the chance of microbial infection. Okay. Then we're going to return to the patient after within 5 minutes. Okay. So to determine if the medication needs to be reinserted. So we're going to return if the medication, so before I forgot, we ask the patient to remain in the flat position to prevent the expulsion of the medication. And now is I'm going to return to the client within 5 minutes, okay, to determine if the medication is expelled. So if that happens, then reinsertion is necessary. Okay, so ma'am, mabalik lang ko, ma'am, after 5 minutes, ma'am. Okay, so para may evaluate ikaw. Mabalik lang ko, ma'am. Okay. So assuming that the 5 minutes is already done, so now is I'm going to observe for effects of the suppository. So for example, for the bowel movements and for the relief of nausea, from nausea 30 minutes after the medication. Okay, so the rationale behind this is to evaluate the effectiveness of the medication and the client's relief from the symptoms. Okay, so that's it. So for the recording and the reporting, okay, so I have here. Okay, so we're going to record the administration of the medication. We're going to record the administration to the patient's chart, and we're going to place the initials or signature to the medication sheet. Okay. Then also on the opposite time it was administered. Then we're going to record the client's response to our nurse's note. Okay. So, mangutana ko usog ma'am, kamusta na ka ma'am? Kumusta yung gibati ma'am after sa administration sa atong medication ma'am?
Pero kung nalimit ako constitution, nakaligaw na ako ng Ganina, lipong mo ko, pero nang uli-ulian na karoon, kung ako, nag-skip ko na ako siya.
Okay. So the client's response is compared to the compare ato na feel niya nung una before and after administration is na-relief na siya since constipated siya. Then naka-feel na siya sensation nga makalibang na siya and dili na kayo labad yung ulo, so na-relief na siya from nausea. Okay? Then we're going to report any unusual systemic effects to the nurse in charge or the physician. So that's it for the administering the rectal suppositories. So thank you ma'am for watching. So see you for my next return demonstration.